Let's ask the question, is migraine a disease then?
No. If you can prevent it and if you can treat it without medications, then what are the chances that it's a disease?
So it's not a disease. So what's wrong with the current medication?
Okay, so there are several problems. One of them is that assume that you have a migraine that also happens to have a headache with it. The medications are aimed at reducing the headache or make the headache disappear, but that didn't make your migraine disappear. So you still have a migraine. You just don't feel the headache part of it, but you may still be vomiting, throwing up, doing all kinds of other things. And so those are out of control. And if those are in control, or maybe you don't have them, because you don't have to have vomiting with every single migraine. Say you have a migraine where you're dizzy, you can't really speak too well, you're slurring, or you can't comprehend, you don't really know who you are, you don't know where you are, you recognize people, but you can't really you're sort of kind of out of it. And you also have a headache with it. And so you take a medication for migraine and it's going to take your headache away. You're still going to be completely out of it because it's not working with the rest of the symptoms. It's not going to take away your slurred speech, your inability to focus and concentrate, to recognize your spouse and stuff like that. It's not going to do that. So if you're taking a medication and you're driving on the road, you may still get into an accident as a result of your migraine because it's not controlling your whole migraine. It is controlling one aspect of it. And so it is like, for example, having a broken arm and getting a medication for the pain, but not putting a cast on the broken arm. Mm. And then because you don't know that you have a broken arm because you have no pain and you continue playing with, a tennis racket, it's not going to be helpful for you. So medications really can't address the whole concept of migraine. One of the reasons why they can't address this is because they don't understand what it is. Now, some of the migraine medications sort of kind of attempt to associate itself, the medication, with what they believe is the cause of migraine. And in some cases, they come pretty close to understanding that that particular part is involved in migraine, but they're doing the wrong thing. So take, for example, a medication, the several medications that they give to migraineurs that are also given to seizure. So these would be like the gabapentin, topiramate, and a whole class of medications. And they kind of sort of on the right direction in terms of migraine because they are blocking off of the voltage-gated sodium, calcium channels. And these are basically primarily responsible for some of the things that are happening. But in the case of seizure, for example, these channels are overly active and they're hyperactive, and they have to shut them down, to stop them working so that they won't release a huge action potential. In the case of migraine, it's the other way around. They aren't working well because there's not enough electrolyte at that particular location, not enough sodium, and so they can't generate action potential. So when you block it, it makes it even worse. But they are aware that these channels are involved. And there are literatures out there that will say that migraine is in fact a channelopathy, which means that the voltage-gated ionic channels that function in basically operate your brain don't work for whatever reason. It doesn't tell you why they don't work, but they don't work for whatever reason, time to time, and that's when you get a migraine. So they kind of understand that those channels are involved, but they aren't looking at how they're involved and where they are involved. And one of the reasons why they aren't involved, I'm just doing a literature research because I'm about to write an academic article that may or may not publish, but I'm going to try one anyway to include my Stanton migraine protocol. And I'm doing a literature review just to see exactly this. Where is the literature? What does it say migraine is? And there is not an organ that is not listed under the auspices of migraine is caused by. I mean, it's absolutely ridiculous that they're going in every direction. But I have not yet found a single article that it would try to grab all these and see, well, what's common in all these and how would these work together? And what may be that stands out that, okay, this forms a unit that can. not one of them does that. And so that is what I'm doing. And that is what I did with my protocol. I read all these papers before. Some of them are newer, so that's why I'm doing a review to see what new academic articles are in there that I can pull into this explanation of the Stanton migraine protocol, basically in this academic article. And I'm seeing that there's a lot of research, for example, on the electrical activity of the brain that is different in migraineurs, that the cortical spreading depression, which we can talk about, that it exists in only aura migraine. Articles say that, no, it's not just aura migraine, it's all migraines. Other articles say, no, it's not even there. I mean, there's so much confusion that it's very, unless you really stand back and you're not too close, because if you're too close and you're doing your research just within, say, the cortical spreading depression, then you won't see anything else, because that is your narrow focus area. And it takes all your energy to focus in on that. But if you have colleagues or like me who are not involved with that research, but we can look at it from the outside, and as a migraine sufferer myself, I can say, well, do I fit that? Is this relevant to me? Is this relevant to the 16,000 other migraineurs that I know in my migraine group? Can this account for any of what's happening to them? And if yes, then I can incorporate it. Okay, so this may be part of it. And then it's my task to explain how it works. And that's basically what I do. So as you can see, the reason why it is so complex and why it's so difficult it is to even define what it is because we can't look into the brain. And humanly, we can't run any experiments on humans. Ethically, it's not. Even when we do experiments on rats or rabbits, even that is ethically questioned. Plus, we don't know if what they feel is really a migraine. So we're just guessing game. We have no idea. They can't tell us that they have a migraine. So we're just sort of kind of making assumptions. And oftentimes, because of misdiagnoses are so rampant, when they're trying to do a clinical trial, be it medication or for anything else, the people that they're pulling in for the clinical trial, how do they evaluate that they are migraine sufferers? If they can't even diagnose migraine, how do they know that the people they use for these examples or these experiments are in fact migraine sufferers? So we're facing multiple problems there. So hence the medications have problems because they don't know what to address because the questions have not even been asked properly.
Angela, you mentioned serotonin as a therapy in the book. Let's talk about that. And then move on to the electrolyte imbalance, which you just mentioned.
Mm-hmm. Right. Serotonin, though, is not really a treatment. Yeah. Triptans have serotonin in them. So there is one class of researchers and doctors who believe that serotonin actually helps migraine, but it doesn't. And people who take triptan, and I used to take triptan regularly, right? And they do work about 50% of the time. But if I replace triptan with a cup of coffee, it'll do the same thing. And triptans are vasoconstrictors. So basically what they work is because they're vasoconstrictors, but they only work in certain times because if I happen to have a pressure increasing or some other factors that would require my cardiovascular system to actually have vasodilation rather than vasoconstriction, then they increase the migraine. So even there, we have a problem. So serotonin is not participating. It's just the vasoconstriction itself that does.